Can you tell us who you are and what you do for Green Dog Dental?
My name is Michael GEIST. I'm a veterinarian. I'm the Chief Medical Officer of Green Dog Dental and Veterinary Center. I'm also a board-certified internal medicine specialist.
And what will we be talking about today?
Today, we're going to talk about endoscopy.
So first and foremost, what is an endoscopy?
Endoscopy is a way of investigating and looking inside a part of the body with a camera.
When are endoscopies used?
So the wonderful thing about endoscopy is that it is a minimally invasive way of looking inside the body. And that may include looking inside cavities such as the nose, the esophagus, the stomach, the small intestine, the colon, and in some cases the ears, in some cases the abdomen, in some cases the bladder or other parts of the urinary tract or genital tract.
And what form of problems would be diagnosed when you do a dog endoscopy?
Well, that's going to depend on the problems of the particular dog or cat. For dogs that need a gastrointestinal endoscopy, the most common reasons are going to be related to possible ingestion of a foreign object that we need to remove from the stomach. And some examples might be a baby toy like a pacifier or a coin. Other examples might be chronically ill patients that are vomiting frequently or having weight loss or are regurgitating or chronic diarrhea.
Why do you think endoscopies are so important?
Well, in many cases, it can offer a diagnosis for a chronic problem where other tests haven't given you an answer. A lot of tests will be done in advance, such as blood work, and these are helpful to rule out other conditions that can cause some of these common signs like decreased appetite, vomiting, diarrhea, and weight changes. However, sometimes we need to get to the bottom of the problem, which is getting a sample from the insides. The majority of the times, clients opt for a minimally invasive option for themselves and their pets, like endoscopy, versus more invasive approaches like surgery.
Do I need to take my dog to a specialist in order to get an endoscopy?
It is recommended that an endoscopic procedure is performed by a board-certified specialist.
Will my dog need anesthesia to undergo an endoscopic exam?
Anesthesia is generally required to do an endoscopic procedure. The majority of the reason is because the patient needs to be still. It is very difficult to pass a camera past the throat and into a stomach in an awake patient, and that is the standard in humans as well. So general anesthesia is used not because it is painful, but because we need the patient to be still.
That is the next question. Is this a painful procedure for my pet?
We do require anesthesia because we don't want the patient to be uncomfortable with the scope entering the various cavities that need to be investigated.
How should I prepare my dog for an endoscopic procedure?
All patients undergoing endoscopy need to be fasted for 12 hours prior to being put under for general anesthesia. For gastrointestinal endoscopy, where we're inserting the scope into the stomach needs to be empty.
Will my dog need any special treatment to recover from an endoscopic exam?
Most patients that are otherwise healthy or stable going into an endoscopic procedure will recover quite smoothly. Some patients, based on the underlying reason why we're scoping them, may require some therapies to make them feel better. For instance, if the reason for scoping is for vomiting, we will often treat with anti-nausea medication. Some patients will go home with new therapies based on the findings we see with the scope. Other patients who may have had a scope of a location such as their nose or their bladder or their airways may have other therapies that need to be done. But again, none of these procedures are painful. However, they may need treatments to treat their underlying disease, of which why we're running the test.
Are there any risks or side effects associated with these procedures?
There is a very low risk of the scope itself causing internal damage to the underlying organ. However, this risk is very, very rare, and dependent on each patient's case, the very low risk will be discussed prior to doing any procedure.
Before these procedures happen, what sort of lab work or tests need to be done in order to have the endoscopy?
Pre-anesthetic screening will always include having a full blood panel assessing patients' kidneys, liver, electrolyte, and white and red blood cell parameters within 2 months of scheduling any endoscopic procedure. Each patient will have a blood panel run at least within 60 days of any endoscopic procedure to screen them and make sure they're a suitable candidate for anesthesia. Some patients, we may perform other tests like abdominal ultrasound, x-rays, or CT scans, dependent on the location of the body that is going to be scoped. For instance, a rhinoscopy or a scope of the nose is often accompanied with a CT scan.
How is my dog monitored during the procedure?
All patients during the procedure will have their vital signs monitored, blood pressure, EKG, heart rate, pulse oximetry, which is making sure that their blood is well oxygenated, as well as their body temperature.
How effective are dog endoscopies in providing diagnoses?
I mean, ultimately, we have an opportunity with an endoscope to go in and see things with our own eyes on the inside of the organ, which is really, really helpful because we can actually visualize if there are any abnormalities with our own eyes. In addition, we can take samples and we can do it without having to do surgery, without having to cut or cause any pain.
Are there any signs of complications after this procedure that I should be aware of?
Depending on the location and if a sample is collected, there can occasionally be a little bit of bleeding from that sampling. In addition, depending on if it's a nose, the gut, the stomach, or the urinary tract, there occasionally can be some inflammation associated with the procedure. Medication can go home in those cases.
Why would this procedure need to be repeated, if at all?
There are times when the biopsy may not be representative of the true disease. A pathologist will look at the sample in great detail, and at times, a new sample may need to be collected.
Would there be any other diagnostic procedures recommended by a veterinarian after an endoscopy?
An endoscopy is often performed to collect a biopsy. A biopsy is a sample that we take from the tissue and we send to a pathologist to tell us what they see under the microscope. Based on these results, there are times when additional testing or therapy may need to be done based on these results. Some examples might include additional blood tests or special stains on the sample.
When will the veterinarian discuss the abnormalities or treatment plans for my dog?
After an endoscopic procedure, I will meet with you and go over pictures and sometimes video of what we saw that day. If a sample is collected to submit to a pathologist, which is called a biopsy, those results often take about 5 days to get an answer.